We'll start today's class with the thought the only source of knowledge is experience. Today we'll deal with the topic that is inevitable abortion. Inevitable abortion is a critical concept in obstetric care that all nurses should be familiar with. It refers to a situation during pregnancy where the clinical signs indicate that a miscarriage is unavoidable. This often occurs in early stages of pregnancy and is characterized by symptoms such as significant vaginal bleeding, cramping, and the dilatation of the cervix. As frontline healthcare providers, the nurses play a vital role in the early recognition, management, and emotional support of patients experiencing an inevitable abortion. Understanding the physiological process, potential complication, and appropriate nursing intervention is essential to provide comprehensive and compassionate care. This introduction aims to equip nurses with the foundation knowledge needed to effectively support patients through the challenging experience. First, we'll see the definition of inevitable abortion. It is a clinical type of abortion where the changes have progressed to a state from where the continuation of pregnancy is impossible. Moving on to the clinical features. The symptoms which you can see here in inevitable abortion: history of amenorrhea for a month, frank vaginal bleeding, severe colicky lower abdominal pain, no tissue is expelled, she may faint due to heavy blood loss. Moving on to the signs which you can notice here are: the maternal signs may remain normal in majority of the cases, but in few cases the signs of shock due to blood loss. So what are the signs of shock which you can notice is tachycardia, hypotension, that is the blood pressure of systolic BP is below 100 mm of Hg, and cold clammy skin can be observed. The uterine size: the uterus is felt firm, that is contracted. Pelvic examination: internal cervical os dilates, admitting the index finger. Moving on to the complications. Complications, the first one is blood loss, which will lead to shock and even to death. The second one is the infection of conceptus and the uterus. So these are the two major complications associated with inevitable abortion. Moving on to the management of inevitable abortion. To take appropriate measure to look after the general condition, to accelerate the process of expulsion, to maintain strict asepsis as outlined in the conduction of labor. So these are the three goals, or the three areas where you have to focus in the management of inevitable abortion. First one, you have to see that you maintain a general condition of the patient, and you have to try to accelerate the process of expulsion. And the third one, of course, to prevent infection, you have to maintain a strict asepsis in conduction of labor. Moving on to the general measures, the morphine 15 mg is given intramuscularly. Excessive bleeding should be promptly controlled by administering methergine 0.2 mg if the cervix is dilated and the size of the uterus is less than 12 weeks. The shock is corrected by intravenous fluid therapy and blood transfusion. Active treatment: before 12 weeks, dilatation and evacuation followed by curettage of the uterine cavity by blunt curate under general anesthesia is quite effective and safe procedure. Alternatively, the suction evacuation followed by curettage may be employed. So you can either go for dilatation and evacuation followed by curettage, or else a suction evacuation followed by curettage can be employed. After 12 weeks, the uterine contraction is accelerated by oxytocin drip, that is 10 units in 500 ml of 5% dextrose, which is started at 40 to 60 drops per minute. If the fetus is expelled and the placenta is retained, it is removed by ovum forceps if lying separated. If the placenta is not separated, digital separation followed by its evacuation is to be done under GA. If bleeding is profuse with the cervix closed, suggestive of low implantation of placenta, evacuation of the uterus may have to be done by abdominal hysterotomy. So these are the measures which can be adapted after 12 weeks in inevitable abortion. So today we have dealt with the inevitable abortion. Understanding and managing inevitable abortion is a crucial aspect of nursing care in obstetrics. As healthcare providers, the nurses must be equipped with the knowledge and skills to recognize the signs and symptoms, provided appropriate medical and emotional support, and facilitate necessary interventions. Compassionate care, effective communication, and emotional support are integral to helping patients navigate this difficult experience. By staying informed and prepared, the nurses can ensure they offer the highest standard of care, ultimately improving patients' outcome and emotional well being during such a critical time. I hope you have understood today's class. If you have any doubt or questions, you can please put it in comment section. Thank you.